Hey guys, welcome back to my channel. First of all, sorry I look like this. It's been a long and painful day. It also has been a while since I've spoken with you guys. So, my first video, I told you guys a little bit about my CML story. Second video, we talked a little bit more in-depthly about CML, the phases, and the treatment. So it's only appropriate that we get into TFR, treatment-free remission. So before I tell you guys my story, I want to give you a little bit more information about TFR and what it is. Just so you guys know, the information that I'm giving you guys is actually from the Leukemia and Lymphoma Society itself, and I will post a link to the article itself. So, there's something called MMR, major molecular remission, and DMR, deep molecular remission. So, I actually didn't know the difference for the longest time, and by longest time, I mean this week. I've had CML for almost 6 years. May 26th will be my 6-year cancerversary. Some people don't like celebrating it, but personally I do because it reminds me that I've been winning all these years and I will continue to do so. So yes, I will be celebrating my 6-year cancerversary on May 26th. Now anyway, MMR, major molecular remission, is defined as anything less than 0.1%. So this means 1 out of every 1,000 cells comes back positive with the BCR-ABL1 gene or the Philadelphia chromosome. Now DMR, deep molecular remission, means 0.0032%, which means 1 out of 32,000 cells comes back positive with the BCR-ABL1 gene or the Philadelphia chromosome. Now obviously that is a better response because that means fewer cells are coming back positive, and that is more ideal. For a patient to be an ideal candidate for TFR, they have to be on the TKI for 3 years and have a deep molecular response for at least 2 years. Now that is to be an ideal candidate, according to the Leukemia and Lymphoma Society. And now some reasons to do TFR, besides the obvious, not wanting to take TKI anymore, because let's face it, these medications are terrible. Side effects, terrible. Just terrible. I mean, the pain that I'm feeling from Scemblix is just not ideal. But, I mean, let's face it, they do the job. At least for me, my numbers are responding. I've been undetectable for a very long time. And I'll get to that when I talk about my experience with TFR. But, I mean, it's just, what can I say? These medications are awful. But some other reasons besides the obvious. Insurance as a big one. Another reason is for younger women who want to get pregnant. In order to do so, they must come off the TKI a certain amount of time before trying to become pregnant. I forget what the requirement is, whether it's 6 to 9 months before trying to become pregnant. And obviously they're monitored more closely to make sure their PCR is stable. If you're curious about that, ask your team. I know my team has offered that option to me, but that's not something that I'm interested in right now. If you hear that noise, it's my blinds from the wind. Another option is interactions between other medications. So for example, I take a blood thinner. I take Xarelto. Now, the TKIs and blood thinners generally don't get mixed together because of the pre-existing issue that the TKIs have of easily bleeding and bruising. But if you're like me and you have a bleeding disorder, then you must take an anticoagulant or blood thinner. I had a pulmonary embolism in September, and I have a blood clotting disorder, lupus anticoagulant syndrome, so I do not have a choice. I have to take a blood thinner. But other examples, which, by the way, I use something called Interaction Checker from drugs.com. It is wonderful. I've been using it for the whole time that I've had CML. It isn't just for CML drugs. You can literally use it for anything. I'll post the link for that as well. For example, I take Seroquel. So the TKIs have this, I guess, possible side effect of like QT interval prolongation, which is basically a heart rhythm on your EKG, and it isn't life-threatening. It basically just can make that rhythm a little bit longer than it should be, but Seroquel mixed with the TKIs can make the likelihood of that side effect more probable. That's just another example. But say you put like Sprycel with Xarelto, so you type in Sprycel and Xarelto, it'll tell you that there's a severe risk or severe interaction. And it'll tell you like, can highly increase the risk of bleeding or hemorrhage. Or if you put like Sprycel with Tylenol, it'll tell you no interaction. So it basically tells you from no interaction to moderate to severe. And again, you can put any medication in there. So if I put like Xarelto with ibuprofen, it'll tell me that there's a severe interaction, again, with the risk of bleeding. So that's just another aside. But it's a wonderful tool. So highly recommend it. So back to TFR. So we talked about the reasons why some people would do it. We talked about the difference between MMR and DMR. Another thing, deep molecular remission can be called CMR, complete molecular remission. That's basically like the best response besides undetectable that a patient can have before trying TFR. So basically what a patient aims for when trying TFR is to obviously maintain that lower than 0.0032% or undetectable. So when I tried TFR, I was just under being on the TKI for 3 years, but I did have a responsive DMR for 2 years. And I went back and checked my portal to make sure, because I actually wasn't sure. I actually did a video on my phone, and I was so unsure of it that I was like, let me redo it, because I like completely had misinformation in it, and I wanted to make sure that I had all the info right. Especially because at the time that I was doing TFR, there was something called the stop trial, and hence the name. Patients would enter the trial, they would stop the medication, and then they would be followed for an increment of time, for like a length of time, and then a different increment of time for another length of time, etc., etc. But I didn't qualify for the trial, and I always thought it was because I didn't have MMR for a certain amount of time, but now I know it's because I wasn't on the TKI for 3 years. I was only on it for 2 years. I achieved MMR in 6 months, but really I maintained DMR in 6 months and thereon for 2 years. So now that I know, I can give you guys the true information. So when I tried TFR, I was on Sprycel at the time. You can basically stop the medication. It depends what you're on, and it depends what your doctor feels like. For me, we just stopped it because I was on 100 milligrams. We didn't build up to 100. That was always my dose. So they didn't wean me off. They just kind of like said, okay, stop taking it. And so we did. Now, I thought I was crazy. And when I read this article, I felt a lot better because there's something called TKI withdrawal syndrome. And I've seen it in the groups that people are like, why is my pain so bad coming off the medication? I thought I would feel so much better. You're not crazy, trust me. It's real. TKI withdrawal syndrome, basically, the bulk of it is musculoskeletal pain. And it can last somewhere between 30 to 60 days. You're not crazy. However, it made me feel a little funny to see that the likelihood of people who take dasatinib and have this is less. So I was like, that's a lie. Because I had so much pain coming off of Sprycel. It was terrible. It was actually almost worse than when I was on the medication. And I was kind of like, I regret this. But yeah, it was pretty bad. So I did try TFR for my first month. Or actually, I think for my first, this is where I'm a little unsure, and I should have probably double checked this. But I know for at least my first month, I came back undetected. And then my numbers did slowly start climbing. And it was when I hit about 0.3, we decided to go back onto the TKI. So I believe I was off the medication for a grand total of about 3.5 months. And then because of the joint pain, we tried Bosilif. which is another second generation TKI. That was awful. Like, if I thought Sprycel was bad, Bocilif was like the angry cousin. And now that I know, obviously I knew that they were both in the same generation, but Dr. Morrow, my new CML specialist, was telling me that I probably didn't tolerate Bocilif well, because Bocilif and Sprycel are pretty much the same. Granted that they're in the same generation, but they're pretty much almost like the same medication, which is weird because some people don't tolerate Sprycel well, but they tolerate Bocilif well, and vice versa. So it's just like a little mind-boggling to me. But anyway, I did not tolerate Bocilif well at all. Like, I had very, very minimal pericardial effusion, which was like fluid around the lining of my heart. I gained like well over 35 pounds. I did not even look like me anymore. I basically like turned into this huge blob. Like, I joke you not. I'm still working on losing the Bocilif weight, and this was like, in December, it'd be 3 years ago. Yeah, like, it was so bad. The nausea was awful. I had like a rash. My hair started thinning out. It just was not ideal. So we actually went back to Sprycel. And we stayed on Sprycel. I was also being tested for autoimmune disease at the same time because my ANA was so high, which is a test for inflammation. And, you know, it was just, everything was like brushed off to be because of the Sprycel. So, you know, we went back to the Sprycel, and here I am today, now on Semblix. So anyway, I'll get to that in a different video and different story. Now, the two questions I get: do I regret TFR, and would I do it again? For the first one, I do not regret it. I was not misinformed at all. My team made it very clear to me that it was a 50-50 shot. They gave me all the information. They didn't tell me do it. They didn't tell me don't do it. You know, it was clearly and 100% my choice. I don't regret it at all. It was an experience. I learned from it. I got 3.5 months of no TKI. I got to drink my favorite juice, blueberry pomegranate juice, because for whatever reason, you can't have pomegranate with TKIs. I don't know why. If somebody knows, please let me know. And I'm not upset about it. At first, you know, I kind of knew I was going to have to go back on the TKI. You know, I guess it was just like a, you know, this is too good to be true type thing. Everybody would tell me don't be negative, but it wasn't me being negative. It was kind of me being realistic. And then would I try again? That's where I'm not so sure. So given that I failed once before, and that I've used like several medications now, you know, I've used Sprycel, I've used Bocilif, now I'm on Semblix. I've read somewhere that Tasigna is not the best option for somebody who has a bleeding disorder. Hi, I have a bleeding disorder. And I was told ponatinib would not be a viable option because of the side effect profile. So that basically only leaves Gleevec and maybe Sprycel if we go back and lower the dose. I'm 25, so those are not the best odds and numbers. And Dr. Morrow told me that if I stay in DMR in June, I would be eligible to try TFR again. And I know that Dr. Morrow's ultimate goals for his patients is to do TFR. I'm not running to do it, just because it's only been 2 years again. And he also told me that the longer you stay in DMR, the more of a chance you have at a longer and more successful chance of TFR. So I'm not running to do it. I've seen that some doctors want like 3 years of DMR, some want 5. In the UK, they want like 8 to 10 before even discussing it. So it's like, I don't know what the right answer is. You know, according to Leukemia and Lymphoma Society, 2 years is like adequate to be eligible. So it's, you know, I don't know if there is a right or wrong. I feel like it depends on the patient when they feel right. I mean, obviously there has to be some set of standards, you know, at least the 2 years and 3 years on the TKI, but that's just how I feel. I would never ever try to dissuade somebody from trying. Granted, it's not my position to do so. I'm not a doctor, but I have had people ask me, like, what do you think I should do? My go-to response is discuss it with your team. Discuss it with your team, discuss it with your family. If you have a therapist, discuss it with them. You know, it shouldn't be a decision that you make all on your own, because ultimately it is a life-changing decision. you know, like, it really is, you know, and, you know, that's what your team is there for, you know, to give you all of your options, to help you make the best one, but ultimately it is your decision. You know, people ask me, again, do I regret it? I say no. You know, again, when people ask me, I said, if you have all the information in front of you, you've been perfectly informed, and you feel like you're ready to go for it, then, you know, do what you think is right. But I would never tell anyone, like, oh, don't do it, you know. Just because mine didn't work out doesn't mean that somebody won't have complete success, you know. So that's where I feel on it. And yeah, so I hope this helped. I'll share those links with you guys. Thank you for watching, listening, whatever. Do what you think you can't do, and do the unimaginable. Bye.